This is Stigma, where we talk with leaders from many industries about how mental health and addiction have impacted their lives. Many people suffer silently from mental illness, addiction, depression, anxiety, and trauma. They never seek help because of stigma. In this podcast, host Stephen Hayes and his guests share their stories of recovery in order to encourage others to do the same. Here's Stephen.
Welcome back to another episode of the Stigma Podcast. Today's guest is Kevin Dedner. Kevin is founder and CEO of Henry Health, which is a digital community that provides self-care support and cultural sensitive teletherapy. Henry Health's initial target audience is Black men who have the lowest life expectancy of any population. In fact, the stated goal of Henry Health is to increase the life expectancy of Black men by 10 years over the next 25 years. Kevin has over 15 years of experience in public health. He has a master's in public health degree. He's worked on a variety of issues, including childhood obesity, HIV/AIDS, tobacco control, and others. He's worked with numerous public health entities, including the nation's largest public health foundation, the Robert Wood Johnson Foundation. And he's going to tell us a little bit about Henry Health today. He's also going to talk to us about how we can frame mental health as a public health issue and why we should be doing that. He's also going to share 5 things that we can be doing to improve our own mental health. I'm going to share his contact information and the Henry Health contact information in the show notes. So if you want to get in touch, you can find him there. But without further ado, Kevin, thanks for coming on, man.
Well, thank you for having me. I'm excited to join this conversation.
So one of the things I'd like to have you do for our listeners is just kind of give us an overview of Henry Health and maybe start with the founding story and walk us into, what the business is and how you're helping people.
Well, great. Thank you. Thank you for that question. The best way to start by telling you about Henry Health is actually telling you about my own experience with mental health. And that is 5 years ago, I worked myself into mental exhaustion, and that exhaustion led to a period of depression. And my depression, like so many others, was an arresting depression. And when I realized I was depressed and sort of like I had this aha moment that something's not right, I started looking for a therapist and saw 3 therapists before I found a therapist that was a good fit. And Stephen, I have a background in public health. And so, after my depression, I had a successful public health consulting practice. And so I thought I would just go back to working on my consulting practice and rebuilding my consulting practice when my co-founder Oliver reached out to me and asked me, had I ever considered doing anything in digital health? And in that moment, it was as if a light went off and everything that I had experienced personally in my depression made sense. And I can see, how I could take that experience that I had personally and use it for something good.
That's really interesting. And so, when you thought about that personal experience and you decided I'm gonna build something to help other people that have had my experience. What was the vision at that point? What did you think that you were going to build? Yeah,
so I think another sort of level setting thing in the conversation for me is to also talk a little bit about what my work was looking like before my period of depression. My background is in public health. I actually started out in believe it or not, in politics, thinking that I was going to work for elected officials and so forth, and really got somewhat jaded with like the exercise of politics and started to pursue a career in public health. And really it was public health advocacy that really made me fall in love with public health. And so, all of the big public health issues over the last decade or more, I worked on, from HIV to childhood obesity to tobacco control. And before my depression, I had started to do a lot of work around health disparities. In fact, I was working with the Robert Wood Johnson Foundation, helping to design their national strategy to address health disparities. And in that space, I just became keenly aware of Black men having the lowest life expectancy of any population. And I was, really like deeply, deeply disturbed about it because in all of my career, I'd never really had heard anyone talk about it or lift it up as a public health priority. And, in public health, we're trained to really follow the data. I mean, like even now, as we record this podcast, the news reports are coming out about how African Americans are suffering at greater rates from mortality rates from coronavirus. And so, when I discovered this problem with Black men's health, I just like I can't believe nobody's talking about this. And the deeper I dug into it, the very surprising thing for me was to make the correlation between mental health and unmanaged stress, right? And, in public health, we've been very slow to frame mental health as a public health issue. But I saw, and there's, very, very compelling data. People have published on it, over and over again. But unfortunately, like most things in academia, those papers are sitting on a shelf somewhere and never make it out to the real world. But the data is very compelling that unmanaged stress and untreated mental health issues are drivers for, sort of chronic disease, which leads to premature death. And I deeply wanted to do something about it. In fact, I was trying to rally people to invest in it as a priority and and candidly couldn't get people to pay attention to it. And it, after my own depression and realizing that it was stress that really pushed me into that depression, I woke up and I wanted to do something with my personal experience. I had no idea of what that would look like until Oliver said, "Have you ever considered doing something in digital health?" And in that moment, a light literally went off for me.
You wrote a blog post in November of last year, and in it you mentioned some of Dr. James Sherman's work, which basically proves that sociological pressures associated with being a Black man increase poor health outcomes in cardiovascular health and in other areas. How do we get people to focus on this? How do we get society to focus on it? How do we get Black men to focus on taking care of their health? And how do we get people to provide the right kind of help to solve this?
Yeah, I think that is the $1 million question. And I think that is a question that we've set out to answer. And part of our hypothesis and thesis at Henry Health is that if we can normalize people learning to manage their stress on a daily basis, meaning like, can we introduce people into tools like meditation, breathing techniques, these things that we know have the ability to slow our mind down, to slow our heartbeats down. Like, can we get people to adopt those things? And so part of what Dr. Sherman proves in his research is that Black men are moving through life with this heightened awareness, like heightened alert. We can use lots of analogies to describe this, but essentially, at basic level, if you think of like the human and how we're trained to interact with fear, it is a fight or flee type mode, right? Like that is how we commonly deal with stress. And so what the research is showing very clearly is that because of like these sociological pressures, and Stephen, it's also important to note that in many occasions, people are even unconscious of it, right? Like it's not like you're like, oh, my heart's beating faster. So basically you're operating with this heightened awareness as if you're in a protective mode all the time. And so what's happened to you physically, that means that your blood is moving through your veins much, much faster, causing much more strain on your organs and strain on your vessels, and it weakens your immune system. And so, I mean, it's literally, to some degree, I think like the public health person in me is like, I'm like, wow, this is happening. And, even now I'm so aware of it when it's happening to me. But I think, the way that we get people's attention, particularly the people who we're trying to get them to change their behaviors, is by introducing them to these techniques and socializing them into these techniques to take better care of themselves. We have a lot of internal conversations about this, and the language that we're using to describe it is like healthy habit sharing. Like we want people to be very aware, of how powerful mindfulness is. And I know that that the evidence is very clear about the effectiveness of, even meditation. Like it's not a debate about how powerful it is in helping to reduce stress and anxiety. Now, what I will say, Stephen, on the other side of that is payers and systems, they know that they have a problem. They've always known that they've had a problem because the data doesn't lie. And so when they're able to aggregate their data and they see, even with mental health, when we look at the comorbidity, like it's indisputable. There's a problem there.
Another question I have is, how do you go get a black man who is not taking care of his mental health, who's going through life with this extra pressure, not acknowledging it? How do you get that person to know about you and to use your platform to get help? And what does that help look like?
Yeah, that's a great question. A key part of what we're doing at Henry Health is we are building an ecosystem of communities. And the community is really a digital community experience where the content in that community, whether it is meditations, whether or not there are inspirational messages, is culturally competent content built for that target user. And obviously, as we're talking about, our first community is curated, it is built just for Black men. And so what we've seen, Stephen, is that people have organically found their way to us. Because I think that there's something happening in society right now, even before the coronavirus, is I think the awareness around the importance of mental health is really, really becoming like a popular conversation that people are having. We know that African Americans are more likely to buy products when they are marketed directly toward them. And when we think about the creation of sort of this, how mental health, and I know that you know this very well, is really exploding. But most of these mainstream products have not tried to speak directly to minority people, to marginalized populations, whether they be Black men, Black women, members from the LGBTQ community. They've not tried to laser focus. And so we believe this concept of building community helps, number one, to deal with the stigma associated with mental health, because you could become a part of the community and access services, and it's sort of the stigma is gone because it is a place where these habits are shared and promoted. So that's our first belief. But when we think about where we want to sell, what ultimately, as I mentioned earlier and alluded to, payers and systems know that they have a problem. And so, our intention is to be able to work directly with payers, large employers, and say to them, hey, we can help you solve a problem, a pain point that you have. But we know in order to sell at that level, we have to, number one, prove our hypothesis. And so, right now we're experimenting with many ways to bring on customers directly so that we can prove our hypothesis.
And how are you finding people that to join the community here in these early days?
So we're experimenting with Facebook and Instagram ads, but as I sort of mentioned earlier, what has been so surprising is that, for example, last month we didn't do any advertising in Facebook or Instagram, but we had, I think maybe it was like 6,000 unique visitors to our website. So when you think about that as a tech company, I know that you know all too well about like how you think about things like this. So then the question becomes, how do we convert those people into paid customers, right? And then the second question, you're like how did they find us? And guess what? What the Google Analytics is showing us, that they found us just through searches on the website. So that says to me that people are looking for culturally competent solutions. And I'll go a step further, Stephen. The one thing, when you proudly say that our product is culturally competent, you may not be a Black man, but you may be looking for a culturally competent product. And so that if someone is going to be culturally competent to one population, that they will have enough humility and respect to be competent to you as well.
I really love that point. I think that's a really strong point, and I think that will resonate with a lot of people. And one of the things I was kind of curious about is, you've got a lot of traffic, you've got a lot of interest. I think it's really exciting what you're doing, and I think a lot of people are probably hearing you describe this business and they're wondering how they can be helpful. I mean, what are you in most need of today as far as support from potential users or potential investors or potential partners? I mean, how can people help you with your mission?
Wow. Well, thank you for that. Well, we are in a race. And so, if people are interested in participating in a seed round that we're raising right now, I certainly invite people to reach out to me directly. And, we can share with them where we are in our plans. And if by chance there are payers or systems who, find themselves in a place where they have a pain point of getting more mental health services out, we're certainly excited and interested in talking with potential payers and systems. I mean, I think that the coronavirus has, as before we started recording, you and I were talking about this, life has changed. It has
Yeah.
fundamentally changed. And I think that what that also means that it has opened up the doors for, telehealth services and certainly for teletherapy services. And so I think that, what payers and systems are going to find is over the next couple of months that the mental health impact of coronavirus is going to be far lasting. And so I think that there's going to be a real need for telehealth services. And certainly we want to be a part of that solution. And, then obviously there are probably individuals listening who could benefit from our services. And right now we're providing services in DC, Maryland, and Virginia. And, we're happy to be in service. In fact, we have actually cut the cost of our therapy sessions through June the 1st. Really just, I mean, we're essentially providing therapy at a very, very minimum cost to make sure that people have the resources they need to make it through this very difficult period. And then, people can just follow us. I mean, I think, like most early stage startups, we know, I think, we need people who will rally around us, who are interested in spreading the word about the work that we're doing. And so they can, come to our website, and there are a number of places that they can sign up to stay in contact with us.
And I'll link a bunch of that in the show notes. So anybody listening that wants to learn more, if you go to the show notes, or you go to our website or wherever, go to his website, you'll find all of this information. So we'll make that readily available.
Great.
And something you had mentioned earlier, you had mentioned that we've been slow to frame mental health as a public health issue. Why? What would it look like if we were framing it as a public health issue?
So I think that's a great question. And let me just say this before the last election, I think politically we were at a place that mental health was beginning to be framed as the next public health priority. Obviously, I would say right now the coronavirus is the public health priority. But before the coronavirus sort of took America by storm, I think we were struggling with what is our public health priority. And as someone who's, been working in public health, you know, over the last decade or more, what I can tell you is that the public health community has always been laser focused on the problem we were solving. We were solving the problem of HIV/AIDS, the challenge of HIV/AIDS. We were solving the problem of tobacco control and trying to, sort of reduce these deaths by tobacco. And then, we went to childhood obesity. So there are several of us who thought that the groundwork was being laid politically to move to mental health. And after the last election, it just seemed like that momentum died out. And so I just want to say that was very disappointing. And I'm looking forward to the day, because for something to become a public health issue, let me just dig a little deeper here. We have to also have like the political leadership, the resources of the government saying that this is a priority. Here's what's happening here. So I think, in a world where mental health is framed as a public health priority, that means that, there are some payers who are sort of getting this right, like a Kaiser Permanente, with their framing of like, I think they call it total health. And, from that standpoint, it means that we're viewing health as a whole, and we're acknowledging mental health, as like a core part of well-being and individuals being able to function in society. And so, I think that means when it becomes a public health priority, you see, government funding, you see foundations and nonprofits rallying around it. And it really changes the whole attitude. If you think about what happened in tobacco control, right? What we successfully did, if you pulled out a cigarette now in front of like your teenage kids or something, they say, hey, what are you doing?
Right.
that's not healthy for you, right? So when something becomes a public health priority, that will be sort of the attitude about how we view mental health. And that will be, I mean, such a game changer in this country. And to some degree, I think that millennials are much more open to talking about mental health.
Why is that? Why are they more? Why are millennials? Because I agree, I see that on the college campuses, and I see it in a lot of the data. Why is it that millennials are better at talking about mental health than somebody in their 40s or 50s or older?
Yeah, I can't answer that. It's obviously I think it's just something generational. I'm a Gen Xer, and we're pretty independent. We grew up with keys around our necks, and I saw a meme the other day that said, we can handle staying at home, and because we stayed at home by ourselves all the
Right.
time. So I think it's something generationally, culturally about what how millennials have grown up, what they experience collectively, that they're more open.
Mhm.
I honestly, I haven't thought very deeply about what is the big difference, but I'm very aware of it. That is that there a lot of times I get people reaching out to me and they're much more younger. It's interesting because I think for me, what I have is millennials reach out to me, and then people on the other end who have had the toll of mental health like taken on them, where they've fallen
Mhm.
into depression or literally had to retire early because the doctor was saying you have to cut your stress or you won't be here.
Wow. But maybe there was another solution for that person. Maybe that person could have engaged in some mindfulness practices, gone to therapy, taken care of their mind, focused on their mental health, and maybe retirement. Wasn't the only option for that person. Am I understanding that right?
Absolutely agree with you, and I think that is a really sort of insightful point there. And I think that that's the goal of introducing people to these techniques that we know work.
Why is that doctor who told that person not telling them, hey, retiring is a solution, but you could also take care of yourself a little more holistically and let me show you how?
So, Stephen, I think that's a great question. I think it actually goes back to your question about what would it look like if mental health was a public health priority. Part of what I think the outcome would be when mental health becomes a public health priority, it means that we all have a new language, new tools to talk about how to manage our mental health. And I think, for many physicians, they're so focused on treating the sickness that they're not looking at this whole person. And so I think that,
Hmm.
the reframing of mental health as a public health priority would also empower physicians with a whole new language. I think about, for me, I always go back to my own personal experience with depression. When I realized I was depressed, I went in for an annual physical, and I told my primary care physician that's, and say something's not right here. And I explained, I thought I was depressed. And he went away and came back like with an 8-page printout with 3 rows, 3 columns on each page of therapists who I could call. He didn't tell me anything about mindfulness tools that I could use to calm myself down. He didn't say anything about any deep breathing techniques. He didn't even listen, these days I give a talk and I say, hey, there are 5 simple things you can do to improve your mental health. Cook with real food, real relationships, spend time outdoors, exercise, and 8 hours of sleep, right? He didn't even ask me though that battery of question. Well, tell me how you're sleeping. What are you eating? Like he didn't go through that. And I just think that part of this shift means that we establish this level setting of knowledge of what needs to happen to have just a baseline of mental health, but also we give people the tools to talk about how to support people in doing that.
Right. Yeah, I agree. I wanted to go back to the conversation about the government and politics, and what are what are some policy changes that we're going to need to see to be able to get the reframing of this mental health issue as a public health issue?
I think we've made a lot of progress policy wise. Obviously, more people are covered and have health insurance today. We have quote parity, but the truth is people often wrestle with their payers around payment for mental health services.
Hmm.
I go back to my experience. I think most founders are trying to solve a pain point of their own, right? So I saw 3 therapists before I found a therapist that was a good fit. Now, it just so happened that the therapist that was a good fit was not in my network, which meant I started out paying out of pocket for him, right? And when I realized he wasn't in network, I asked him, could you try to do the paperwork to speed up the process of you getting into my network? And he was gracious and he agreed to do the paperwork to get into the network. And originally we thought that it would take like 90 days. After the 90 days, he was not in the network. And, I pushed myself and I think I went maybe another 2 months paying out of pocket. And then I had to get him to refer me to someone in network. But he was working for me. And I'm not saying that the therapist who he referred me to did not work for me. Obviously I'm here and talking, but just even that process of, trying to make sure that someone was in network and coverage, like that, there has to be a policy solution to something like that. I think, the clear pain points when someone is experiencing mental health, number one is, can I find a therapist who will understand what's happening in my life right now and respect my background, my experiences, my culture, etc. Number two, will they accept my insurance? And I think, there are policy solutions for, both of those questions, candidly.
Yeah, I don't disagree. And that's really insightful, really informative. And I appreciate you doing this and coming on to tell us about Henry Health, to tell us about your background and talk about public health. And before we go, I wanted to kind of ask you a couple of sort of rapid fire questions here to let our audience get to know you a little bit more personally. And I hope you don't mind, but I was just going to ask you 4 or 5 quick questions. And, these are just, 3-5 second answers, usually 1 or 2 words. And we'll do this real quick and,
Sure.
and then we'll wrap up if that's all right. So, what's your favorite mental health app? And it's okay to say your own if you'd like.
I won't say it's my own right now. I do listen to Use Calm's meditations a lot right now. Our app is not completely built yet, so I don't mind telling you that I do use Calm.
Yeah, Michael's great. Calm's awesome. What's your favorite book?
My favorite book is The Fire Next Time. It's an old book written by James Baldwin.
Got it. Favorite TV show?
Oh man, that is a crazy question. I think right now I just finished binge watching Ozark on Netflix. So I mean,
Oh, I love it.
but television is hard now because you got all the writing is so great on some of these shows, right?
I know. What about favorite self-care activity?
Man, I love working in my yard. And that may not sound like a self-care item for some people. Some people may find that stressful, but spending time outdoors has been proven to reduce your stress. And I literally love working in my bed. It's like having to clean dirt out from under my nails. So working in my yard is my favorite activity.
My wife and I have been out planting in our gardens for the spring, and my job is usually to fix all the broken sprinklers, which I kind of hate doing in the moment. But when I do turn them on next time and they work, I feel a sense of accomplishment.
Yeah.
And, last thing, what can someone out there listen to this podcast do to reduce stigma and sort of drive the agenda of reduced stigma and improved public mental health?
Yeah, I think vulnerability is the most powerful tool, Stephen, that we have. And even, I just want to thank you for your vulnerability and the work that you're doing and sharing your own experiences. But none of us get to escape having mental health challenges in life, whether it is, the loss of a loved one, the loss of a job, the impact of the coronavirus. All of us are impacted in some way. And I think the more that all of us talk more openly about what we're experiencing and what we're feeling, we will start to destigmatize and normalize mental health and people accessing mental health services.
Well, I appreciate you sharing that. And I agree with you. I think vulnerability is a key to a lot of our societal issues. And I think if we were all a little more human with each other, we might be able to find solutions to some pretty complex problems pretty easily. So thank you for coming on. Thank you for sharing your story and talking about Henry Health. And I really appreciate you spending time, taking time out of your schedule to do this. So thank you very much for being here.
Thank you. And thank you for the work that you're doing every day.
So yeah, Kevin, thank you again for being here. Really grateful to have you spend time with us. I learned a lot from this conversation. I'm sure others will too. And thank you to our audience. Really grateful to have you here. We'd love to hear from you. We would really appreciate you subscribing on Apple, iTunes, or leaving a review, giving us feedback on an episode, or reaching out and communicating with us over Twitter at StigmaCast or on our website, stigmapodcast.com. You can email us, info@stigmapodcast.com as well. And we'd really love to hear from you. So thank you for being here. And until next time, stay well.